Okay, well, welcome everybody. So we're going to get started right on time. This is the post-transplant session. And I have with me two wonderful people. I have Julie Purschke and I have Jillian Smith. And I'm just going to go ahead and let them each tell their story about how the disease affected their family and the transplant process. So Julie, go ahead.
Oh my goodness. Okay. Hi, I'm Julie Purschke, and I just have to have a disclaimer. I am not very tech savvy, and my first time using slides and sharing my screen, and I already just messed up, I think. So bear with me. We're going to go ahead and try to see if I can share my screen.
Okay.
Okay. Okay. Except now I need to go back to the beginning.
Pretty good. All right. That looks good. Yeah.
Okay. Here we are. Okay. I'm here I'd like to share Nicholas's story of success. I know in the world of ALD, a lot of times you don't hear hopeful, positive, successful stories. So my mission today is just to share a story of hope. Finding out your child has ALD, as we all know, can be very devastating. And usually once you start doing your own research and online, you enter this downward spiral of hopelessness. I'm here to say that there can be and is hope. My son Nicholas is living proof thanks to early diagnosis, early detection, cord blood transplant, and the amazing care we received at the University of Minnesota. So there he is, right after transplant, or after we were allowed out of the room, probably day 30 or so, with his bald head. So I live in St. Louis, and my husband, Dave, and we have two children, obviously Nicholas, who just turned 16 and just received his driving license, which is terrifying. And our adopted daughter, Gabrielle, who is 12. I have a family history of ALD. My father, Nicholas's grandpa, had AMN. He was an early patient of Dr. Hugo Moser back in the 90s, late 80s, early 90s, I guess it was, early 90s. He died at age 56 from AMN, and I found out I was a carrier at age 15. In the process of starting adoption, we actually found out we were pregnant. And so we knew once we had our child, we didn't know the gender, that we would want to have him or her tested. So Nicholas was diagnosed at birth through newborn screening. And it wasn't until later that I became very thankful knowing that my dad, having that knowledge of knowing that we had it in our family. It's kind of a crazy thing to be thankful for, but the main reason is the benefits of early diagnosis. So because we knew Nicholas had it from early on, we right away contacted Dr. Raymond at Kennedy Krieger, and I had already had a connection there because of my dad. We entered Nicholas in the Lorenzo's oil study at age 1.5, and he was part of that study until he was 10 when the study ended. Through that study, he was on a low-fat diet. He had yearly MRIs. We would travel to Johns Hopkins every year for those and to have a whole workup done. And at age 10, we received our second most devastating news was that they found a lesion on his brain. It was very small, very slightly detected only by ALD trained eyes. And in Dr. Raymond's words, it was not angry. At the time, we could sit on it and hopefully get him into the gene therapy trials that were happening. So that was in June. Nicholas was 10, and by January, we were getting MRIs every 3 months. We were living on pins and needles, worried constantly. And Dr. Raymond wanted to see us up in Minnesota. He had switched to University of Minnesota at that time in January. And at that time, we met Dr. Wes Miller. We had time on our side. It was very early detection. He had no symptoms at all, and that was a huge benefit. I'll go on to the next one. So Dr. Wes Miller is the wonderful doctor in the middle there, and that is a picture taken after transplant. So So once his lesion was detected, like I said, we went up in January to see them. We had bone marrow match workups and discussions. They found 2 perfect matches of umbilical cord blood. And then again, we were still in a waiting pattern because the lesion wasn't angry. It was not progressing. But by July, when we returned, there was some enhancement, and we needed to move forward with transplant. The gene therapy trial had closed at the time. This was back in 2016. So we went through with transplant. Nicholas and I packed up from St. Louis and moved to Minnesota, and he started a long heavy dose of chemo regimen to wipe out his immune system and get it ready for his new cells he was going to receive. It was not an easy road. There's a wonderful picture of us all smiling on transplant day. And I think within 5-10 minutes after that, he went into anaphylactic shock and we almost lost him because they think it was an allergic reaction to the preservatives in the cord blood. But thankfully, he came out of it. We will forever remember Transplant Day for several reasons. And that was September 5th, 2016. So not necessarily the easiest of days. Transplant recovery. Nicholas went in, a big point I want to make is he went in very healthy. He was active, he was healthy, he was not showing any symptoms, like I said before. He wanted to come out of this. He turned 11 soon after transplant, and he wanted to come out of this as healthy as he was before, which was a big thing to ask. But he worked really hard to stay active during the recovery process. You see him in the picture there, doing some OT and PT. They would bring all kinds of activities in for him to do, even basketball and hockey in his room. He set goals for himself to stay with his 6th grade class by Skyping in, and we had a tutor in Minnesota. He wanted to continue eating as much. I know a lot of boys after transplant lose their appetite. He did for a while, but not very long, and he was determined to not go on that, to not leave the hospital with the feeding tube going on. We had mask and hand washing and sanitizer and all that pre-COVID times, but he was released, I think it was before day 30 from the hospital, and then we stayed for 4 months in Minnesota for care at the Journey Clinic, some blood transfusions, some ups and downs with that. But finally getting to go home in December, and we were followed back in St. Louis at St. Louis Children's Hospital by Dr. Sheila Shenoy. Before we left, there's a picture of him and Dr. Lund and the research lab down there at the bottom, because he really wanted to see what they were doing with the fish and the mice and how that was all going. When we came back home, it was challenging. I think part of the reason with the steroids he was on, but also what he was going through, there were a lot of emotional highs and lows. He was very angry, lots of emotions, lots of anger. We were still isolated at home. He had a lot of lack of energy, tiredness. He would tell me often in tears, I just want to get back to how I was before. I want to be at 100%. I just am so tired. I want to get out and run. I want to exercise. So just a lot of really rough times in that 6 to 8, 10 months after. And then we had a turn, I would say about 10 months post-transplant, where he did start to get some of his energy back. He did start to feel more of himself, and was able to start exercising. There's a picture of him playing basketball in his N95 mask. And here we are at 1 year at transplant, after transplant, his rebirthday, and he was feeling great. We had us Make-A-Wish trip about a year and a month after transplant to the Ironman World Championships in Kona, Hawaii. And he got to participate in the kids version, where he did a swim, a bike, and a run, a triathlon, which he really enjoys doing. So that was huge to come that far from only maybe 4 or 5, 6 months earlier being angry and at a low of, am I ever going to feel better again? So that was a gift, a huge gift. For life after transplant for him is really good. We are very lucky. He did not have graft versus host disease. I know that's a huge gift. He is back to doing all the things that he loves doing. We are 4 years out. He earned his Eagle Scout Award in the spring at the Ronald McDowell House. He's participated in triathlons. As you see here, he runs for his cross country team in high school. The one thing that it does continue to affect him is his adrenal insufficiency, or Addison's. That's a daily challenge. This year, especially with his growth, we've had to tweak his med dosing, and he's just not performing like he would on the cross country field. Even though he's doing really well, he has to really change up his hydrocortisone and the meds he's on. And it's kind of I feel good this day, I don't feel as well the next day, but overall he's able to do all the things he wants to do. We continue to have yearly MRIs. ALD continues to, the progression is halted. I think it was, Dr. Lund will remember better, probably at 60 days after transplant, it was halted. He doesn't take anything for granted. He knows he's an example for other ALD boys, and he knows he's an example of hope, and we're just so grateful for that. And to close, while he was going through transplant, Nicholas was talking about how there really isn't any event or a run or a walk for ALD, at least in our state of Missouri, and why is that, and can we get something like that going? And of course, while he was going through that, we made a promise to him that we would get something up and running in that area. And so we had our first run for ALD the year after transplant, and we formed our nonprofit the year after that, Knockout ALD. And we're actually preparing right now for our 4th annual run a week from today. I'm surrounded by t-shirts in my dining room office, and we are nearing $70,000 raised in hopes to help other kids like Nicholas and have better outcomes like Nicholas did, and to support the research at the University of Minnesota so that more boys can live a healthy life and enjoy all the things that life has to offer. So thank you for letting me share my story.
Oh, it's a fantastic story. So I enjoy hearing it and reliving it. So great slides.
You were a part of it, Dr. Lund. Thanks.
And thank you. So let's hear from Jillian, and then we'll see if there's time for questions from people.
So our stories are pretty similar. Grady was a late find, unfortunately. He was diagnosed at 7. We have 0 family history. He was diagnosed with a LES score of 10. So we were pretty freaked out. We had to move pretty quickly. The first doctor that we spoke with didn't make it seem too hopeful. We knew that we wanted him to be a 9 and under for transplant. And about a week later, we met Dr. Eichler, and he met with Grady. I'm sorry, I'm so distracted because I can't see you guys at all. Okay, there we go. And once Dr. Eichler met him and saw him, he thought that, it was definitely worth taking a chance, but we were petrified. Grady, like Nicholas, is a big athlete, loves football, everything like Nicholas. Basically, we thought we were going to lose all of that, and we kind of lived a few days thinking that that was going to be the case, that we were going to lose him. But we started transplant about 10 days later. We had a perfect match. I think it was about 2 weeks later. We were going September 20th. We were able to have his transplant. I'm sorry, you guys. I'm so off right now since this didn't come up again. Transplant went very well. We didn't really have many issues until about a month or so after transplant. We realized that his LFTs were elevated. So he does have liver, skin, and eye GVHD, and we've been having a really hard time getting the liver GVH under control because he hasn't been responding to medications. But he did come home 30 days to the day from transplant. He had some weakness. We did a lot of physical therapy as well. He was very adamant to just keep going. I think a lot of our big things, I think with you guys, Julie, we pushed that exercise and the physical, make sure you're taking walks, keep going, don't sit around.
Yes.
It was huge. I think that had a lot to do with why he did as well as he did.
I agree.
yeah, he loves to do anything he can to help the boys. It's very important to him. We've, in our little community, we've all kind of gotten the boys somewhat together, whether they video chat or whatnot. We're just working really hard to try to go forward.
I know from my perspective, it's awesome to see Grady. I agree. I think Grady, Jillian and I have kind of bonded over the fact that our boys are such huge athletes and love sports and basketball and are fans of some of the same teams, and they're in touch through Instagram. But yeah, I agree, Jillian. I think the exercise was huge to both of our boys, that they wanted to get back at their sports and they wanted to do as much as they could to stay healthy and get back their strength and so forth.
Here we go. Just tell me if this works.
Yay, something's there. Yay!
Yeah, okay.
Yay! Oh, good.
So that's Baby Man, big
Okay.
sports. It's like the typical things too, like you guys can see, like we talked about the skin color. He was always a lot darker than all of us. But I'm a good tanner, so we kind of all just thought, but like I said, big football player. This was, where's the next slide? So this was like during transplant, and you can see he looked great. I mean, as you can see at this middle slide, I mean, the kid never shut up. So we kind of would come up with our own little plans. He was fun. He was very lucky to meet his idol, Julian Edelman, while we were in transplant, which was a big help for him. It really kept him going. Same thing like you said, our cell day was very uneventful. And I think we all, when the kids are getting a transplant, I think we think that minute or that time is going to be this huge thing. And it really just kind of press the button and cells go in like a transfusion. Grady deals with a lot. I think a little bit differences of Nicholas is Grady was symptomatic. So initially we thought he couldn't hear us, but he was dealing with auditory processing. So he was losing the ability to understand language and sounds, which he's adapted to beautifully. It got a little bit worse in transplant, during transplant while we were there, but he's learned to read lips like a champ. He's a little too good. It's hard to get things past him. But we're working with that. We're working with some OT, working with speech. But he had the whole prednisone, like all the boys get the prednisone and the eyebrows and all the stuff that they do there. But post-transplant, I mean, he's amazing. He's had zero progression. Although he does have GVH, everything's dealt with at home. He looks good. He doesn't really look so symptomatic, but we're still at Dana-Farber bi-weekly-ish monitoring. He's back to playing sports. He was back to school full-time. He missed a year, second grade, but third grade he went back and was doing so good and was just starting to get the hang of things until this dreaded COVID hit. But he has a one-on-one para in the classroom, so a lot of things have changed. And I think like you said, there's so much anger. There's a lot. We're still in the anger phase and the depression and the anxiety because he wants to be old Grady. He doesn't want to have a parrot in class. He is lost a lot. You'll see him playing with his friends and he loves it, but he just has this lost little face because he has no idea what people are saying. So he gets really angry and he'll start acting out, but he's really doing a lot better. We were super active all summer. He's still playing basketball. Unfortunately for Grady, his big sport was football. And going forward, he'll never be able to play football again. So that was really hard for him. And to us, we all think he's here, he's doing amazing, he's such a rare outcome. But to him, that's the end of the world. And I think we forget sometimes in their tiny little worlds how devastating these things can be.
Yes.
But he's a champ, he's doing really well. We've done a couple fundraisers, not quite as big as Julie's, but we did Grady's Best Day Ever last year for Dana-Farber towards ALD research for Dr. Duncan. I think we raised, it was a little close to 40,000 for our first year. And Grady started his own little fundraiser for our transplant floor called Grady's Gifts that he started the first year. He wanted to be able to provide gift cards to the family so they could provide gifts for their children over the holidays and not have to stress about it. So the first year he did 6,000, last year he did 12,000. And this year, after 2 weeks, we're just shy of 10,000 again for the floor. So with a month to go. So he loves stuff like that. That makes him feel like he's really giving back and doing well. But I'm really proud of him. I think it's great that we can share, Julie, like these types of outcomes that are out there too, that I think people don't always see all the time, unfortunately. But whether you have a low less score like Nicholas or a less score like Grady's, that sometimes people hear a 10 and they assume that they're already so far gone. And some places might not have given Grady the chance of transplant. And, you know, look at him, he's great. He's just your typical 10-year-old boy.
I don't know. That's fantastic. Thank you. So there are a lot of kudos and thank you from the audience. There are a couple of questions that have come in on the Q&A. So one is, thank you so much for sharing. If it's not too difficult, may I ask what your father with AMN passed away from? 56 seems young. Did he progress to cerebral disease?
Yes, yeah, that's a good question. And I didn't want to take up too much time and explain more about him within my presentation, but yeah, now I would like to explain that a little further. He was, you know, one of the earliest patients. He was obviously a late diagnosis. He had broken his leg and it wasn't healing, and his doctor here in St. Louis had somehow heard of Dr. Moser's work and referred him up there, and that's how he was diagnosed. And yes, it was just AMN at first, but the longer he went on, the last 2 or 3 years of his life, he was in a nursing home. And my mom and I kept pushing that there's something going on with his brain and with his, you know, there was just other symptoms. And again, this was a 90s, early 90s, I guess, mid 90s. And we really had to push for it. And in the end, it really was about, I think, a month or two before he passed away that we got acknowledgement from Dr. Moser that yes, he thought he had also, and was the cerebral form as well. So yes, that is what happened.
Thank you for that. And then our good friend and fantastic advocate, Janice Sherwood, asks, would Grady be a good candidate for cochlear implants? Which you and I have talked about a little bit.
Yeah, so it's kind of confusing with Grady because so his hearing is actually perfect. He has no actual hearing issues. So we had tried an FM system for a little while, but really all it was doing was amplifying everything. So the best way to explain it is that you were screaming Spanish at an English speaking person. So he can hear you, it just, there's a disconnect somewhere where it's just not making sense to him. So cochlear implants wouldn't help, but it's interesting that you brought that up because that's where I found auditory retraining. I had done some research on the cochlear implants of children who had never heard or been able to hear prior. Once they got them, they had to relearn the language the way that they were hearing it now. So I thought, well, what's the difference with Grady? If he can still hear it, like he might hear the word dog, but now it might sound like to him or something like that. So when I brought it to Eichler, you know, they said it's worth a shot, but you know, traditionally what you've lost, you don't know, you know, it's hard to get back. But like I said, on another board, I'm pretty stubborn, so I kind of just kept on pushing it. So I got him into auditory retraining, and it's actually gone from 2% blind speech, where blind speech being he needs to read your lips. He was only getting 2% of what was being said. He's up to 65% now. So he's doing really, really well. There are days that he could be downstairs, I'll call his name and we can have short, like, I'll be like, Grady, you'll say what? I'll say dinner. He's like, I'm playing video games. You know, like we can have short conversations, but most of the time he has to read my lips. But we have tried, we do actually think once we can get the blind speech even higher, that the FM system might actually help just have him concentrate more, like when he's in the classroom. So he's in the classroom, he has a laptop at his desk, and the teacher wears a microphone and it transcribes everything she's saying. So he'll read what's being said in front of him. But yeah, it's confusing sometimes to people, and sometimes people don't understand. So I'll kind of shortcut it and say, sorry, he can't hear you, because it's just easier than explaining.
Right.
Good. So to continue on, just for the many families that are out there that might be in transplant or not be in transplant, you know, we do our best to counsel families pre-transplant. And as you both know, I spend a lot of time trying to explain it. And I always say, you'll never understand until we're on the other side, and then you'll understand what I'm talking about. So is there advice you could give for families that are preparing for transplant? Is there something we should have said or not said? I don't know. I'll let you each answer what you thought.
I think you're right, Dr. Lund, that each family is so different and each patient situation is so different. And I know with us, some families educate themselves on it beyond everything when they're going through it. I didn't do that. I was too scared after the first 2 days. So I didn't want to know. I didn't want to know the types of chemo regimen he was going to have. I didn't want to know anything. I just kind of said to Eichler and Duncan, just do what you can to save my son. We trust you. But I didn't know if I remember leaving the night before, because I think we were under the assumption that the chemo would accelerate the progression and that we weren't going to be bringing home the same grade that we left with. To some extent, I think we were expecting loss of vision, loss of hearing, change of gait at the very least. So every day we would just I would stare at him and he would blink 3 extra times. I'm like, it's happening, it's happening. My husband was a lot stronger than me at that point, and he did do a lot of reading, so he was able to navigate it a little bit better than I was in the beginning, I think. But there's nothing you can really do to prepare. I mean, I would just suggest don't read, listen to your doctors, and look at your children. I mean, even coming home, when Grady was having a hard time, his legs were very weak, he couldn't run. And I think we were scared, thinking, okay, he's starting to lose his ability to walk. But you just have to push them and keep the physical exercise going, stretching, working out, and look at them. I mean, you have to look at your own child. I think we all get hung up on a lot of the numbers, like with the less scores. Everyone gets so caught up on that number, but everyone's number is so different. Like Grady's a 10, and there are boys I know that have less score lower that have a lot more deficits than him, or vice versa. So
right.
I don't think there really is anything.
Location.
Right. I just don't think there's anything you can do to truly prepare for it. Just make them as comfortable as possible. You're going to spend a lot of time in there.
Yeah.
Julie, what do you think in your preparative process?
I think Jillian said it all perfectly. And it's funny because I think we were in the same boat. Jillian, I was the same way. I did not want to read, even though I had the history in my family. Online research was not my thing, and it would just depress me. So Dave would do it. And so thankfully he kept it to himself, but he was armed with the knowledge. I was the one that went in emotionally and dealt with exactly what was going on. And like you said, just dealt with Nicholas and looked at him. And I said, I think my advice would be is constantly, because I'm communicating with a couple families going through transplant right now. And I just constantly say, watch, like you said, Jillian, watch your child, read their signs, and be an advocate for your child. Know what you think is best for your child. Trust the doctors. I went in and said the same thing. I trusted Dr. Miller and Dr. Lund and Dr. Hashem. And I was just like, we trust you. You know, I'm not going to research the chemo regimen. You do what you think you need to do. But then also, you know, be an advocate for your child, and that if they're in pain, or you think that something's not right, or like when he went through the anaphylactic shock during transplant, I knew something was not right. You need to speak up because you're the only one that knows your child the best. And that I think is one of the biggest takeaways I would take and share with other families. In addition to that, also find something that your child likes. Like our boys loved sports, so they played in the hospital room. They found ways to play hockey and basketball and whatever. Where I know someone going through the transplant right now for a different rare disease, she likes to dance, so the PT is dancing with her. You know, so find something that's going to keep them going, keep them focused, find them joy, some shape or some form while they're going through this horrible time, and be your child's advocate. So
that's really good, and you both are outstanding advocates. So another question that comes up to me a lot pre-transplant as well, and I don't have an easy answer, but how do you manage life during the transplant process? And it's so hard to answer this for a family. Like all I can say is like they figure it out somehow. But
yeah.
You don't have a choice. I think it's one of those things that when you're in it, you don't have a choice. You don't even have time to think about it. Not right now. Sorry. We were so lucky. And I know other families weren't as lucky as this, but my mother-in-law was able to take a month off of work And so she stayed at home with Colin, my then 4-year-old or 3-year-old. So I stayed with Grady every day and every night, and then Jeff would come every other day. So then Colin still had some normalcy. It's hard. I mean, the emotional toll it takes, the stress it takes, not only on a child, not only on the parents, but the siblings. I mean, you're forever changed. Everything is forever changed. And being gone for a month.
Life after transplant. Yeah.
Yeah, the younger kids kind of get stuck on the back burner for a little bit, which is really, really hard. And then even after, I mean, my Colin's now 6. He's never had any formal schooling because the first year we were in isolation. He couldn't go to preschool. Last year, he missed so many days because of all of Grady's appointments. So he has to come and be told to sit in the corner and be quiet and don't talk, but that's not natural for them. You know, so it takes, every family's different. Then there are families that don't have that option, which I don't know how they do it. Or if you live far away, I mean, we're 35 minutes from Boston. We were so lucky that we could do that. But I mean, you guys traveled more, so you probably have it better.
Yeah. We had to transplant our lives, literally transplant our lives.
Yeah.
And we were told in July to get our lives together to come back in August. So yeah, thankfully we had family that jumped in, and I had a month to prepare and get things ready around here. We were leaving my daughter and my husband here so he could work, and so that she was in 3rd grade so that she could continue and have some sort of life here. And Nicholas and I were leaving, and that was the hardest thing to do. One of the hardest things to do. And you just trust and hopefully have a community that will help you. And, you know, people gave Dave miles so he could come see us, fly up every weekend. I think there was a time though we didn't see him for 2 weeks, and then my daughter would come, you know, once a month or once every other week. And she got the shaft. She got the total shaft, but you just trust God and trust your family and friends to take care of them. And she was cuddled and loved by everyone here back home. And hopefully she's better off for it. But I know that you know, there's a lot of guilt over that too. I mean, on my part. Yeah, you live moment by moment. You take one moment at a time and do what you need
but
to
even still, Julie, right? I mean, for you, 4 years out, for us, 2 years out, it's still, I mean,
yeah,
gotten a little bit more normal. I mean, COVID's not helping anything, but I think one of the most important things for people, and I can't speak for you, but shocker, I'm pretty controlling. I'm not good at asking for help or accepting help. And I remember a friend of mine said to me in the first couple of weeks when Grady was diagnosed was, you need to take all the help that's being offered to you, no matter how big or how small, because right now people are going to be offering all this stuff, but that goes away after a while. Yeah. And I think with kids like Nicholas and Grady on the outside, they appear just like your typical average kid. I think people forget how fragile they still are in a certain sense. And maybe more so Grady's a little bit still not as far out as Nicholas, but it does. The help, the offers kind of go away after a while. I mean, don't get me wrong. We have wonderful friends and we have family that helps and stuff like that, but it's just, there's so much help that you need. So if someone's going to offer you to bring dinner for your family or do this, don't say, no. Take the help, take all the help you can get.
I remember feeling that way even when we came back home and everyone thought he was okay. Well, we still had another 6 months of recovery. And it's like, we need help. And that's when the help kind of dwindled because they all helped so much while we were away. And it just meant the world to have a meal brought by or just someone to reach out because you still need the help. That's when the caregiving really kicks in when you come back home and you feel so isolated and so alone. And even now, like you said, there's still things. I mean, there's still medications that Nicholas takes. There's still doctor appointments he has to go to. There's still things that day in and day out. And people look at you and they're like, what are you talking about? Like, well, he still has this, or he still has Addison that he'll always have, you know, and there's still medical things to deal with. And yes, just offer the help, take the help. And yeah, it still can be challenging.
I know we only have like 3 minutes left, but that just made me think of one more thing for new families going through things. And someone brought up the other day about survivor's guilt.
Yeah.
I sometimes catch myself apologizing to some of our friends in the community whose sons either haven't made it or are much different situations that we're in.
Yes.
And there's almost that guilt of when you do get angry and frustrated and complain because they're here and they're doing so well, but everyone's something is something. So what's going on for Grady for us is devastating. Watching him suffer and cry, watching him try to understand, having to turn the lights on at night to say, I love you, so he can hear you and understand you is a hard thing. And just those simple little things, you know, that are taken away, that at the end of the day, you just thank God so much that they're not little things. To us, it's devastating. It changes your entire life. So don't compare. You can't compare. Your hurt is your hurt. Everyone's something is something.
So true.
Just be there for each other and listen and try to help as much as you can help. But all of our stories are so different.
Very much so. Yeah, very much so. Because even though Nicholas looks perfectly healthy, there are struggles, as he struggled this year with his sport that he loves. He's like, why can't I'm so scared that the sport I love and that I'm good at, I won't be able to continue to do, because his adrenal insufficiency is taking a toll. And even though we're so lucky, like you said, Jillian, we're so lucky and we're so blessed, but yet when your kid is hurting in some way, it's hard. It's still hard. There's still struggles for them. There's still struggles, even though, you know, overall we're very lucky, very grateful, of course.
I'm very grateful for you guys, and we love you guys, and we're so thankful for all of our friends in the community, and
Yes.
our doctors here in Boston, and Dr. Lund's been so supportive to us as well. And
I agree.
what does Jesse say in a, whenever I'll say it, shitty disease, great people.
Yeah, ALD, the disease sucks, but people are amazing. I just read that today from her. She says it all the time. Yeah.
She needs to have a t-shirt, but it's true. We have a pretty amazing group behind us.
Yep.
Great. Well, thank you both for sharing your stories. We're right on time. And I mean, they're fantastic. You're both inspirations to the field and help us as doctors who always need inspiration, just push harder into research and taking care of the patients. So we'll have breakout sessions later today. I think there'll be a lot of interest there, as there usually is, and more discussion to continue. So thank you very much.
Thanks, Dr. Lund.
Good to see you,
Bye,
Julie.
Julie.
Bye. Take care.
Bye.
Bye-bye.